Thank you, Arindji. Thank you very much. I will do it. కొంచెం డోరు అమ్మ ఆ డోర్ ఓపెన్ చేయరా, అది గాలి వస్తుంది, ఆరుతుంది, లేకపోతే దోమలు మళ్ళీ కూర్చుంటాయి పచ్చిగా. Good morning everyone. How are you all today? Do you all remember the previous class which I have taken? Are you all with me? I am delayed because of the IT department. They had to open the door and so I was just waiting outside. So I could not help. Let's start without further delay. Last class was about the postpartum. It was about postpartum period. So we had antenatal care, we had internatal care, and then we had postnatal care. Postpartum is nothing but it is postnatal care. Now after the baby is born, what is that we are going to do? See, we are going to discuss about the newborn care, and the neonatal care. So this is for today. So the newborn care, as you all know that I am Dr. Sugna. So the specific learning objectives of this class are, you should be able, at the end of the class, you should be able to draw the flow chart of optimum newborn care, and then you should be able to describe essential newborn care steps, and then you should also be able to explain what APGAR score is. Then later, then you should be able to describe screening, neonatal screening. So we screen the child who is born for the abnormalities. So we will look into it further when we go further. Then you should also be able to describe the reflexes in the baby. What are those reflexes? We'll see later. Then you also should be able to explain the signs of good attachment and effective suckling, because you know, once the baby is born, the baby is hungry and baby wants breast milk. So you should look for the signs of good attachment and then effective suckling. What is effectiveness? What is efficacy? You have to just read and come back because there is not much time today. Then coming to introduction, 50% of the infant deaths occur in the first 28 days of life. First 28 days of life is called the neonatal period. So when you look at the deaths by first birthday, more than 50% of them who die are during this first 28 days or neonatal period. And this first, when you look at the deaths which take place in this neonatal period, most of them take place in the first week of life. It is most critical period. And then the major causes for the death are, the neonatal deaths are birth asphyxia, hypothermia and infections. Then the low birth weight. The low birth weight, there are different causes which you will learn in the OBG when you have your posting or when you have your theory classes. So the low birth weight. Who is a low birth weight baby? A baby who weighs less than 2500 grams or 2.5 kg, and they are at the higher risk of dying. So if we provide essential care to the newborn, we can reduce both the neonatal and infant deaths or mortality. So coming to essential newborn care. The steps of the essential newborn care are as soon as the baby is born, you want to resuscitate the baby. You want to clean the baby, take out secretions in the mouth, and then do all the steps. That is called resuscitation of the newborn. And then you have to take care of the warmth. The baby should be kept warm, because the baby was in the uterus, and the baby was warm in the uterus in the amniotic fluid. And now once the baby is exposed to the external environment, the baby needs time to get adjusted. So it is our duty to ensure that the baby is given the required warmth, and then you should be able to prevent infections which are very common in the newborn. As soon as the baby comes out, the baby is not used to this environment, and the baby is more prone for the newborn is more prone for the infections. So you should prevent them, and then you have to initiate breastfeeding and also ensure that it is continued. So you should help the mother to manage breastfeeding. Then if the babies are born with birth weight less than 2.5 kg, and if they are sick, they need special care, and the care should be provided by us as healthcare providers. And then you should also be able to identify at the earliest the needs and which require referral, and you have to do appropriate referral. Look at the flow chart of the optimal newborn care. As soon as the baby is born, delivered, the baby can be normal or at high risk. Who is a high risk baby? A high risk baby, like for example, I gave one example of low birth weight or a sick baby. So those two are, let us think that they are the high risk for now. Then if they are normal, they can go for regular nursery and they can be discharged. But if they are of high risk, you have to see whether they have complications or they are without complication. If they are with complication, they need special care and special procedures. So they need a referral. But if they are without complications, you can keep them under observation, and then if they are fit, then you can take the normal steps which the normal infant takes, like regular nursery, and can be discharged to home. This is the flow chart of the optimal newborn care. It's not there in your park. I think you can just draw by yourself. It's not very difficult. You can put the baby delivery, and then normal, high risk, then without, then temporary, then regular, special care. Yeah. Then next comes clearing airways. As soon as the baby is born, you have to establish and maintain breathing. How do we do that? You have to clear all the airways of mucus and other secretions, because the baby was in the womb in the amniotic fluid, and so all the secretions you have to clear it, and you have to position the baby in such a way that the head is low to drain the secretions, and it should always be assisted by gentle suction. You cannot be harsh, because the baby is so delicate. The baby is just born, so you should be gentle when you are removing the mucus and the fluids. Resuscitation. When does resuscitation become necessary? It becomes necessary when normal breathing fails. Usually, most of the babies, they breathe on their own within 1 minute as soon as they are born. So, but if it is not established, then you have to resuscitate. What happens if they do not breathe? It usually is because the baby is subjected to hypoxia during labor. There was not good oxygen supply during the labor. That's why the baby is not able to breathe immediately after the baby is born. So what you have to do? You have to, after doing your suction, you have to apply oxygen mask or intubation or assisted respiration, which you all will be learning in pediatrics under IMNCI. how to apply oxygen, how to do intubation, what are those amber bag, everything is there. They will teach you all. And then to do resuscitation, we need the labor rooms, because the labor room is the place where the women delivers. So it should be equipped with equipment including oxygen. Then what you have to do? Usually when you look at vitamin D in the baby, before that I want to tell you, before I forget, always ensure that you put an identity label with the mother's name on the baby's wrist or ankle. Why do we do that? I think you all might have heard through newspapers that the babies are exchanged, and even the mother feels secured when the label is identity label is placed on the child's wrist or the ankle. So you have to identify to ensure that the baby belongs to that particular mother. So it is usually the name is not given to the baby as soon as the baby is born. So it goes with the mother's name. Then about vitamin K. The vitamin K is given at the dose of 1 milligram for those who are weighing 1.5 kg and above. If they are less than that weight, what do? We give half of the dose. Instead of 1 milligram, we give 0.5 milligrams. Then the who are empowered to give, the staff nurses and the lady health visitor, they are empowered to give vitamin K to the newborn children. And where is it given? It is given on the upper outer thigh and with a sterile needle. It should be 1 inch and the smallest size. Then how does vitamin K help the baby? It prevents hemorrhagic disease in the newborn. And remember that very little vitamin K is available in the bodies of the newborn, and vitamin K does not cross the placenta. So the baby do not get the vitamin A from the mother, and the gut also do not have any bacteria to produce vitamin K. These are all the factors, and other important factor is the breast milk also has very little quantity of vitamin K, and it takes several weeks for the normal the normal gut to start making the bacteria normal gut bacteria to start making vitamin A. That is why we give vitamin A to the newborn. Then comes the screening. You all have to examine the babies who are born, the newborns, for the major malformations. What are the major malformations which we come across in the newborn? One is hydrocephalus, the other is meningomyelocele. All these pictures you will see in OBG textbooks or in the pediatrics. And the large omphalocyte, it may an absent anal opening. So you have to look for all these malformations in the newborn. If they are there, what is your role? You have to immediately refer to the first referral unit. But this first referral unit, wherever you are referring, you have to ensure that there are surgeon and the surgical facilities for children. It's not for the adults, it's the newborn. So pediatric surgeons should be available in the referral facility wherever you are referring. So you have to ensure that they are available so that you can refer the newborn with these major malformations. And you have to ensure, don't ever forget, the baby should always be kept warm during examination as well as during transportation. Provision of warmth. How do we provide warmth? You do not have to allow the attendants or the mother to clean the vernix because the vernix prevents hypothermia and infection. It will keep the baby warm. So you have to check whether the baby is warm or not by touching the feet of the newborn every 15 minutes. And if you feel cold, you can check for the temperature. The temperature usually checked in the axilla. And if it is less than 36.5 degrees centigrade, you have to place the baby under a source of warmth, that is 200 volt bulb, and the baby should be 45 centimeters above the bulb should be 45 centimeters above the baby, or you can also put the baby under radiant warmer. Maternal heat will provide extra warmth for the baby. So you have to keep the baby close to the mother. That's why I am telling that maternal body heat will provide extra warmth to the baby. So what you have to do, ensure that the mother of a baby, to keep that the baby closer to her. You have to ensure that. You have to reassure the mother that the baby will be kept warm if she puts the baby close to her. And you have to teach skin to skin contact. What is that called? That is called kangaroo mother care. This also you will learn in the pediatrics. This is a short notes for you all. So you have to know that it has two components. Kangaroo mother care has two components. One is skin to skin contact and also exclusive breastfeeding. If the baby is put skin to skin, the baby also gets an opportunity to feed herself or himself through breast, and the mother also gets an opportunity to feed the baby. AFGA score. What is AFGA score? AFGA score is, it depends on different variables. One is about the color, baby's color, and breathing. What is the usual color of the baby? The baby is usually pink. If the baby is pale, then you can think of anemia. If the baby is yellow, you can think of jaundice. And if the baby is blue, you can think of anticipate cyanosis in the baby. So baby's color is very important. Then breathing. How many times the baby should breathe? You have to check for every 5 minutes. And then if there is a difficulty in breathing, that is if the baby breathes less than 30 or more than 60 times per minute, then you have to, you should be alert, and you should be able to refer the baby to the newborn to the first referral unit. What is the first referral unit for the primary health center? It is the community health center. And in the community health center, again I repeat, it is usually asked in the Viva, how much population is covered by the community health center? It is 80,000 to 1,20,000, wherein the community health center has all specialists, pediatrician, OBG specialist, then the physician and the surgeon, anesthetist, etc. It will be taught to you all in the health care delivery system. So look at this score. Here are signs to my left, and the scores range from 0 to 2. The maximum is 10. 10 is the best. So then when you look at it, if the heart rate is absent, it is 0 score. All absent or 0, or the muscle is flaccid, no reflex, color blue, pale, and then it is all 0 or it is 0 score. Then comes your 1. 1 is between 0 and 2. If the heart rate is less than 100, it is slow. If it is more than 100, baby starts crying, and the score is given as 2. In the similar way, respiratory rate, if it is slow and irregular, a score of 1 is given, and if the baby breathes well, it is good, and then the score of 2. Then same comes with the muscle. If there is active movement 2, if it is flat sit 0, in between some flexion of extremities, it is 1. The reflex, if baby cries 2, does not cry 0, grimace 1. Then the color, of course, I told you all. then the total scores are added. So it is, if it is 0 to 3 the total score, then there is severe depression, and if the score is 4 to 6 it is mild depression, and the score is 7 to 10 then there is no depression at all. So severe depression, mild depression, no depression. So this is about the APGAR score. This is the short notes. Care of the cord. After the baby is born, then we have just now discussed about the resuscitation, breathing part. Next comes the care of the cord. In the normal infant, cord is cut after it starts pulsating, because the baby gets around 100 ml of extra blood. So it is very important in a country like India, wherein 70% of the women, pregnant women, are anemic, and so it's more important when there is anemia, you have to ensure that the cord is cut after it stops pulsating, so that the baby gets the 100 ml of extra blood, which is lost if you cut immediately and without waiting for the pulsations to stop. So then you have to cut the cord with a sterile scissors or the blade. Why do we do that? That is, it prevents the neonatal tetanus. What is neonatal tetanus? You all read by yourself. And then where to cut the cord? Cord should be cut 2.5 centimeters from the abdominal skin. Then it should be tied with a thread. It should be sterile. Inspect the stump for bleeding. If bleeding is detected, and then you do one more tie, one more thread, a sterile thread, and never use any local antiseptics to prevent umbilical infections. It's not needed at all. There are a number of studies which have been conducted, and they have found that there is no need of using any local antiseptics, and it should be left dry without antiseptic or dressing. It itself shrills away and within 1 week, around 5 to 8 days. Okay, so you don't have to apply anything. If it is asked in the exam, please tell that there is no need to apply anything. Then comes the care of the eyes. The eyes should be cleaned with clean cotton swabs. You should use one swab for each eye, and it should be clean from medial to lateral side. Before eyes are opened, the lid margins have to be cleaned with wet swabs. There is no need of any prophylactic eye applications. Then recording of the birth weight, it's very important. All the babies who are born must be weighed. Why do we like to weigh the baby? We like to weigh the baby to know whether the baby's weight is normal or not. If the baby is less than 2.5 kg, then the baby needs special care. You have to ensure that the weight of the baby is taken. Then prevention of infection. How do we prevent infection? We can prevent infection by administering, actually it should be TD, tetanus and diphtheria. It's a type of error. Then it should be given to the pregnant women. Recently, 2 months ago, they have changed from TT to TD. TD is tetanus and diphtheria. T component prevents the tetanus in the pregnant women. It prevents maternal tetanus as well as neonatal tetanus in the pregnant women as well as in the neonate. Then you have to ensure clean practices, delivery practices. Then the most common source of infection in the newborn, it is through prelacteal feeds. Usually because of the culture, because of the values which they have in the family members like to give some prelacteal feeds, but you have to ensure that they are not given to the newborn. No prelacteal feeds, no artificial teats, and no water, just breast milk. So it has been seen that a baby who is breastfed has less chances of infection when compared to a baby who is breast on artificial feeds. Okay, so exclusive breastfeeding has to be promoted. Then persons with skin infections and whoever handles the baby, who likes to take the baby, you have to ensure that they are not suffering from skin infections, respiratory tract infections or diarrhea. They should not handle the baby because their infection, it is transmitted to the newborn. That's why. And in case, please remember, whenever we are promoting institutional deliveries, and in Telangana more than 92% of the deliveries took place in institutions. Whenever a woman delivers in the institute, tertiary hospital or in the district hospital or in the community health center or in the primary health center, you have to ensure that the newborn is administered 0 dose of oral polio vaccine, hepatitis B and then BCG vaccines are given. The 0 doses are not counted as a regular dose in the primary immunization schedule. I think you will be taught about the primary immunization schedule. And they all should be administered before the child is discharged from the hospital. Some of the infections which you come across in the newborn, I just want to stress about it. One is ophthalmia neonatorum, that is caused by the gonorrhea, trichomatis, staphylos, strepto, candida. So they are very serious because they may cause blindness. So you have to prevent it. You have to ensure that this is prevented in screening the mothers when they are pregnant. Take the history. In the similar way, trichomatis, it is also important cause of conjunctivitis, and it is usually occurs in the low socio-economic group where the personal hygiene is not maintained. In such newborns, we usually treat them with topical neomycin. Next comes the care of the skin. Newborn is wet from amniotic fluid and the can easily become cold. So what you have to do? You have to take a dry cloth. You have to teach the attendants, whoever attends to the baby, to clean with dry cloth and later remove vernix after some time when the baby gets accustomed to the temperature, meconium, blood clots, everything. And then after drying, then you have to wrap the baby in the clean dry cloth from head to toe. How does it help? It prevents heat loss. Then the first baby bath, it can be given even after 1 week. It doesn't matter. But in most of the cultures, they want to bathe the baby immediately after the baby is born. But it is not required. You have to educate the mother as well as the family members. Maintenance of body temperature, which I already told you all a bit about keeping the baby warm. So environmental temperature and this body temperature of the baby, it is usually as I said, it is if it is less than 36.5 degrees, then you should be alarmed. So here, if it is usual temperature is between that and 37.5 degrees centigrade, then the environmental temperature is 10 to 220 degrees centigrade cooler. So especially in the winter months in India, it is not 200, it is degree. It's a typo error. Similarly for 37 point, it's not 50, it is 5 degrees centigrade. So the newborn has little thermal control. The baby cannot easily adjust to the temperature. So it is our duty to ensure that the baby is kept warm. Most of the heat is lost through evaporation of amniotic fluid from the body. So as much as 75% of heat loss, it occurs from the head. That's why you have to ensure that from the head to the toe, the baby should be wrapped with the dry cloth and closer to the mother, for mother skin to skin contact and breastfeeding. And separating the baby is harmful. You should not separate the baby from the mother, because the mother is very much worried about the baby, first thing. And the second thing is maternal body actually produces heat which can be exchanged to the baby. It can be given to the baby by the mother. If the baby is put on the mother and there is a skin to skin contact. Preterm baby, usually the low birth babies, they lose heat very easily. So they should be taken care, special care should be taken, because their skin is very thin. That's why they lose heat very easily. And they have less subcutaneous fat because they are very thin. They are low birth. That's why when there is less subcutaneous fat, there is less insulation. Insulation is not there. That's why. So putting the baby on the cold surface like metallic tray or rubber sheeting, weighing scale, it should be avoided. Always it should be a cloth should be put on the tray or on the weighing scale, and then only weight should be taken. And then all the we have to ensure that cold walls, then open windows, everything have to be closed to keep the baby warm. Next comes your initiation of breastfeeding. Initiation of breastfeeding, it's very important. Breastfeeding should be initiated within half an hour. All the staff should be taught in the ward to ensure that the mother initiates breastfeeding within half an hour. And breastfeeding also helps the uterus to involute, and it also decreases postpartum hemorrhage. So the benefits of breastfeeding, as you all will be learning in your pediatrics, there are a lot of benefits, especially the nutrition and the immunity, and it also increases bond between the mother and the baby. Okay, then you should also tell the mother how colostrum protects the baby against infections, because colostrum has lot of antibodies. Exclusive breastfeeding is nothing but only giving breast milk for the first 6 months of age. This is asked in the exam and it's a short note. Then you have to observe the mother at least for 4 minutes how she is feeding the baby through breast. All those things you will learn in your pediatrics. All these 4 things are called attachment. You have to see whether there is good attachment or no attachment or not well attached. All these 4 points will be taught to you all. The neonatal examination. A neonate is one who is from the time the baby is born up to 28 weeks or 4 weeks. You have to examine, ascertain that there are no injuries in the birth process and no malformation, and also assess the maturity of the baby. First time, of course, all these things I already covered. Then second examination is usually done by the pediatrician within 24 hours. He conducts examination in a good light, and there is a protocol. He has to see for the size, weight of the baby, crown to heel length, head and thorax parameters, and body temperature. Then of course the color I told you all. Then coming to cardiorespiratory activities, he has to check for the murmurs, whether there are any cardiac murmurs. Then feel for the femoral pulse, look for the respiratory rate and retraction during inspiration. About the neurobehavioral activities, posture. Usually the baby has there is a neck retraction and a frog-like posture, hyperextension of limbs and hyperflexion of all limbs. Then asymmetrical posture, muscle tone, tendon reflexes, cry and movements. All these things he checks. Then coming to head and face, especially the pediatrician looks for hydrocephalus. whether there are large fontanelles and visible scalp veins. Looks for the cataract, whether there is any congenital cataract, and then the coloboma, conjunctivitis, ears, any abnormalities, etc. Then abdomen and limbs, it looks for distension, abnormal masses. Of course, I told you all about imperforated anus. And limbs and joints, congenital dislocation of hips and extra digits. Then others, neural tube defects, external genitalia in the males and females, for undescended testes, hydrocele, fused labia, and enlarged clitoris. Length, it is recorded within 3 days. They usually measure from head to toe, and this is done by the pediatrician, and which you will be learning in pediatrics. Coming to head circumference, it is also done during the first 3 days due to molding of the labor. There is a molding of head during labor, and it is usually done by the tape, and the maximum diameter which is measured is the occipitofrontal diameter. Then the purpose of measurements, just they want to measure to ensure that the baby is having the same standards as of the population. If the size is less or more, then they anticipate some complications or some abnormalities, and they treat the baby accordingly. Then of course anthropometric measures, all these things are not required. Neonatal screening, screening usually, I think I taught you all about the genetics. The genetics part plays very important role. So here they collect the 10 to 15 ml of cord blood for typing, Coombs test and other tests to screen for all abnormalities. They are also screened for metabolic disorders, hemoglobinopathies, then phenylalanine hydroxylase. It is very rare. I taught you all in genetics when I was taking a class on genetics in my first classes. Then about phenylketonuria I have covered. Then this is very important, neonatal hypothyroidism. It is usually we check congenital hypothyroidism because it leads to severe mental retardation. That's why we do it, and it is usually done by radioimmunoassay of T4 or TSH. Then sickle cell anemia, then your congenital dislocation, identification. You have to identify the high risk infants to provide them special incentive care. These are the basic criteria. Time is up. Coming to mortality, I already told you all how neonatal period is very important, and first 24 to 48 hours of birth is very important for us to take care of the newborn. Summary: essential newborn care, it consists of resuscitation, care of the baby at birth. We have to provide warmth, prevent infection, initiate breastfeeding and continue exclusive breastfeeding for the first 6 months, identify the baby for any congenital malformations, take the weight of the baby, record the weight. If the baby is below low birth weight or preterm or sick, you have to see that the baby is referred appropriately to the first referral unit. You should be able to identify newborns who need referral and do it accordingly. Thank you. Any questions? Time is up. Other speakers.